Hi, this is Larry Huppin. I am a podiatrist in Seattle. I specialize in sports medicine and orthotic therapy. And I want to talk today about orthotics for soccer and other cleat sports. Now, if you go on YouTube and do a search for Seattle Podiatrist, you see I do make a lot of videos. This one's a little bit different in that it is in lecture format. I actually did this lecture recently at a seminar for other podiatrists, but I've adapted it in a format I hope is beneficial for soccer players and other people that wear cleats and are having foot pain. So my plan here is first to talk about how to ensure that you can be pain-free, at least as far as your feet go, be pain-free when you're wearing cleats. And then we're going to talk about how to make the best custom orthotic to fit into cleats. And if orthotics turn out to be an effective treatment for you, it's going to be critical that you find someone that really knows how to prescribe them and how to fit them into these very small, hard to fit shoes. So we will talk about where to find a good practitioner in your area. And then I also want to make some recommendations on some of the best over-the-counter arch supports that you can use in cleats. Not everyone is absolutely requires a custom orthotic. Some people do great with a very good over-the-counter device. So I'll give you some hints on that also. So first thing, when I'm making an orthosis, I think when any practitioner is making an orthotic device for a patient, so we need to think about what we're trying to accomplish. Orthotics really do one thing, and that is to reduce abnormal forces that lead to tissue damage and pain. Usually there's one of three types of forces or multiple types that we're trying to deal with. That's either tension forces, increased tension on tissue that leads to pain. So for example, a common problem we treat is plantar fasciitis or heel pain. This is from increased tension on the plantar fascia. So in this situation, we're going to try and design an orthotic that reduces that tension in order to reduce pain. Other people have compression that is causing pain. Pressure, for example, pain under the ball of the foot. We'll talk about that in a minute. And then finally, there's shear forces or friction that can cause tissue damage. So for example, friction can lead to blisters. And we can use orthotic devices to stop that friction in order to reduce potential for blisters. So then we have to design the orthotic, write a prescription, take a cast of the foot, and then tell the manufacturing facility how to make that orthotic in a way that reduces those forces so that the patient can be pain-free. And then in this situation, we have to try and figure out how do we fit this orthotic into these very small shoes, right? Cleats are smaller shoes. They tend to be difficult to fit an orthotic in many situations. But there's a lot of tricks that can be done in order to make that happen and still have a very effective orthotic. Now, so our final goal here, our real overall overreaching goal is just to provide the best possible device, meaning the orthotic that has the best potential to relieve that pain, to provide optimum relief of symptoms for that particular patient. Okay, so we're going to take a sample condition here, and this is going to be ball of foot pain. Now, there's a lot of causes of ball of foot pain. Ball of foot pain in general is called metatarsalgia, which means pain under the metatarsal heads, which are these bones right here. That can be different things. It could be something called sesamoiditis, which is inflammation of these two little bones here. It could be a condition called capsulitis, which is inflammation of the ligaments that hold these bones together at the joint. Could be inflamed nerve here called a neuroma. So in all of these situations though, our primary goal when we're designing an orthotic device is to reduce pressure on the ball of the foot, to transfer the pressure from here and put that pressure back here onto the arch. So there's a number of studies that demonstrate how we should best reduce pressure and to use an orthotic to do that. First thing is the material itself. The material has to be fairly firm and rigid. There's studies here, and this one I'm talking about here from the year 2000, that showed that more rigid orthotics did a very good job at reducing pain in patients who had pain under the ball of their foot, but those that used a softer orthotic did not have the reduction in pain. So that's number one. The device has to be made of a material that won't collapse under the foot. If it collapses under the foot, it just doesn't do a good job of transferring pressure. The next thing, and this is really critical, is that the orthotic should conform very, very close to the arch of the foot. And there's been a number of studies that have demonstrated this. You can see this orthotic is gapping away from the arch, while this one conforms close. And there was a researcher at I think this was at Washington University in St. Louis, who's done a number of studies. Many of these studies are done on diabetic patients, because a diabetic patient who gets too much pressure under the ball of the foot can get some very, very serious problems. And so there's a lot of money spent on research on that. But the same principles apply to patients who just have pain under the ball of the foot. And so these researchers showed that this total contact insert, one that really conforms very close to the arch of the foot, would reduce excessive pressure at the metatarsal heads by spreading that force off of the metatarsal heads and moving it back here onto the arch. So how do we do this? Number one, the position that the foot is held in when we take the image or the cast of the foot is very critical. We actually want to accentuate the arch. You see what I'm doing here is pressing down a little bit on this portion of the foot and raising that toe. That essentially raises this arch a little bit. And so an orthotic made off a cast of a foot held in that position is going to conform much closer to the arch than one that's, for example, made without that foot being manipulated like that, or most particularly if you've had an orthotic made with your foot bearing some weight, where you're sitting in a chair and putting your foot down on the floor into some foam or into some plaster. That actually will flatten the arch, and you'll end up with a flatter orthotic that really will not do a particularly good job at transferring pressure off of the ball of the foot. Also, when we write the orthotic prescription, we're going to tell the manufacturing facility, what we call an orthotic lab, to make the device in a way that it conforms very close to the arch of the foot. So from that cast of the foot, or the image of the foot that we send to the orthotic lab, they're going to make what's called a positive cast. It's a mold of the foot with all the corrections built in that we want in order to create an orthotic that's going to give you the best clinical outcome. And what we find is that many times they will add too much what's called fill in this area, which just makes for an orthotic that doesn't conform very close to the arch of the foot. So it's very important that your provider, the person who's making you the orthotics, uses a very, very high quality orthotic lab. You can also do some other, we don't need to go into detail on this, but we can do something called inversion of the positive cast, which also helps increase the arch height in order to better transfer pressure off of the ball of the foot. But the prescription that's written becomes very critical in how the orthotic is made. And then there are additions we can add to the orthotic. This is called a metatarsal bar, and this is called a metatarsal pad. And what these can do is transfer some pressure from the ball of the foot here back farther onto the arch of the foot. And there's different times that you might use either one of these, but again, these modifications can be very important. You can see here we've also left the front cover of this orthotic unglued so that we can then adjust this. Once we're sure it's comfortable, we'll certainly glue that down to make it easy to move in and out of shoes. There's actually been some very sophisticated studies even on exactly where these pads should be placed for the best outcome. We don't need to go into that in detail, but what you can see is that depending on where they're placed and how they're made, this is how much reduction there is in force under the ball of the foot. So you can see that using this versus this, there's about a 10% greater reduction in pressure under the ball of the foot. We also want to provide cushioning under the ball of the foot. There's good studies that show that that is important. So this might be a very nice orthotic device that will be very effective at reducing pain under the ball of the foot. We've got hopefully something that conforms very close to the arch of the foot. We have the pad in here to get pressure off the ball of the foot, some extra cushioning, and that cover that's not glued on the front so we can continue to adjust that to get it perfect for the patient. But trying to fit this standard orthotic into a cleat can really be very difficult, if not impossible. So now we have to adapt this for the shoe. Right? So cleats again tend to run small, particularly soccer cleats. Also, another part of this is soccer players, particularly very serious soccer players, don't want a very bulky orthotic because they feel it can interfere with their feel for the ball. So again, we still want an orthotic that conforms very close to the arch of the foot. We want to incorporate these pads and cushions to get more pressure off the area. But now we want to try and make this device fit into a soccer cleat. And so there's several things we'll do. On the back of many orthotics is a flattened area called a post. But a full-sized post, and I'll go back a few slides here, this is a full-sized post here. That just does not fit well into a cleat. So here what we're going to do is use what's called a strip post. It's only this portion of the post. So we will leave this portion without a post so it slides farther back in the shoe and does so very easily. Then what we're going to do is we're going to thin this portion where it's marked here in order to get it to sit very low in the shoe because soccer cleats are not very deep. And then we're going to make some adjustments to the edges of the orthotic so it fits nicely inside the shoe without taking up too much room. So here's somebody who came back, they have a baseball cleat and you're standing on it. Now this actually fit them very well, but you can still see there's some areas that we could remove here to make this fit even nicer into the shoe. You can see that if this is extending beyond the foot, it's really not applying any force that gives any benefit to the patient. So we can get rid of that portion. In our office we do have a grinder and we will just go ahead and remove that material right there. And make it fit perfectly into the shoe. And then we'll use this little machine to polish it up. And here we're just making it fit even, we're grinding it thinner at the heel so it sits even lower inside the shoe. So anyway, the goal here is to get a great fit. We're also going, because many soccer cleats and baseball cleats tend to be kind of shallow in the toe box, we're going to thin this area up in the toe box here. We can use cushioning. It's very beneficial under the metatarsal heads, but we don't really need it under the toes. So we can make this almost paper thin. So when I'm teaching students how to make an orthotic for cleats, this is kind of the focus I lead them to. Number one is they need to really focus first, most important, on reducing the stresses that cause the problem. That, what forces are leading to the pathology or leading to the patient having pain. So number one is you still have to make the orthosis to reduce those forces. Then we have to adapt it to the shoe. It's best if we can actually send the soccer cleat or the other shoe down to the laboratory when they're making the orthotic so they can fit it to the shoe right there. But you also, that's one of the questions you're going to want to ask your provider when you go in and talk to them about making orthotics for this type of shoe. Will they send it down? And if there's still adjustments that are necessary, can they do those in the office? You want to have the orthosis still as wide and deep as possible. You want to use that strip post, thin the heel, thin the cover in the toe box, give more room for the toes. And you have to recognize that the very best orthotic may not fit into the cleat, but it's sometimes a compromise to get the best outcome that will still work in that particular shoe. Now, here is what I think is the best orthotic on the market that's a prefabricated orthotic that will fit well into cleats. It's called the ProLab P3. If you just go to footanklestore.com and do a search for it, or you go to footankle.com and do a search for it, you'll find that in there. I actually like the non-covered version. I just put it in over the insole that comes with the cleat. But if you'd rather just take that insole out and have a covered version, you can buy one of those also. Now, depending on where you are in the country, if you also go to our website, go to footankle.com, go to the help section, you can find a list of podiatrists in other parts of the country that also specialize in orthotic devices. So that's it. I hope that has been helpful. If you have any comments or questions, please do so below if you're watching this on YouTube, or you can go, if you're watching this on our website, you can go to the blog and ask us a question there. So thanks for watching.